And greetings from the Trinidad and Tobago viewer. We're already getting the questions rolling in, and we're happy you're able to join us from there. Maybe we should do our next webinar from there. All right, let's get rolling. So welcome, as I mentioned. We are in the beautiful Spidertech studio here, and we are thrilled that you're joining us with us today. We're seeing more and more record numbers every single webinar. This is our webinar number 5, and we're really excited to bring this to you today, where we're going to look at using Spidertech to help with joint pain. As always, our mission is to elevate client recovery by arming professionals with the streamlined kinesiology tape solutions. We provide you the highest quality products so you can pass on that quality to your clients, to your patients, and they can receive the best and highest quality treatment. If this is the first webinar that you're tuning into, or you don't know me from previous, I am Dr. Nick Martichenko. I'm the Director of Education here with Spidertech, also a chiropractor that works in the world of golf and tennis, and at home here in Toronto, Ontario, Canada, I work in a multidisciplinary clinic with a number of other professionals as well. Let's jump right into our goals for today. We're going to keep it simple as we always do. We're going to learn how to use Spidertech to help with painful joints. And we're also going to learn how to apply kinesiology, how to apply the Spidertech knee pro cut. What sets us apart from other kinesiology taping companies and products is our pro cuts. They're designed for each part of the body. We're going to review the knee primarily today, but we service the entire body from the shoulder to the mid-back, the low back, the knee, and the ankle. And also we have a FAM which takes care of any fluid, swelling, inflammation that you may have. The beautiful thing about these products is how standardized they are. They're machine cut. They come the same way every time. It's the highest quality product you can get. No scissors needed. As a result, your life gets simplified. Whether you're applying in the clinic or outside the clinic, it makes your life so much easier. As a result of all the corners being machine cut, as a result of the high quality adhesive and cotton, it ends up being longer lasting. It's obviously reproducible because it's the same piece every time. And then that becomes time saving in terms of applying it, but also in note taking in the clinic. And then, as I mentioned, you can apply both in the clinic, at home, or on the field, because you don't have to fumble with scissors, you don't have to reach into the bag for that roll of tape. It all is there ready for you to apply within seconds. So we dive into how Spidertech can help with joint injury. These are the 3 main criteria that we came up with that we would want as therapists to the tape to achieve. So we start with, we want to take care of initially all of the pain markers, which would be pain, inflammation, and swelling. We also would like the tape to be able to help with improving range of motion, balance proprioception, and then tying those together to improve the movement patterns and optimizing your movement patterns. And then lastly, we want to make sure that the tissue tension in the area is normalized as possible. We know that after an injury, the tissue tension has a tendency to change. And so if we could have a way to get that back to our optimal state, that would be ideal. I think it is important to remember here, though, that I believe most of the people that are tuning in today would be therapists. This is not the only treatment that you're applying to your patient. This is the treatment between treatments. You're still going to do all the great things that you do to affect the body and the joints, whether it's soft tissue therapy, manipulation, mobilization, acupuncture, laser, all of these great things that you're already doing, you're going to continue doing those things. this is what you do at the end of that treatment. This is the add-on. This is the thing that there's nothing else that you're currently doing is in competition with. You're not taking something away to add Spidertech in. I think that's really important to remember because if the tape can do all of these great things that we just listed, and you're still able to do all the great things that you do with your hands and with exercise and so on within your treatments, that's a pretty impactful level of treatment that you're providing to your patients. We will come back to this throughout as we kind of revisit, but these are going to be our objectives as to what we want to prove that the tape is able to do and help with. So we'll dive into a couple studies. The first one, we're going to look at one that looks at really swelling, inflammation, and pain. So this is a short study. It spans 5 days. It looks at right before a total knee replacement, and then 4 days post knee replacement. And then we compare that to exercise alone. So we have tape with exercise, and exercise alone would be the outcome measures that we're looking at. And the reason we do that is because the exercise portion is so important after the knee replacement that we're certainly not going to go just tape. We're going to add the tape in, as I mentioned before. So the first outcome measure that we see is our pain, which is the first thing we listed before. And essentially, what we saw was pre-knee replacement. The average VAS, visual analog scale, number out of 10 that was listed was about a 6. That was their pain level, and that was in both groups. And then 4 days post, we saw that if we added in the tape, we were able to take it from a 6 down to a 2. 2 out of 10 would be the pain. If we didn't have tape, we're going from a 6 to a 4. So we're already seeing a significant improvement just by adding tape into those 4 days after a knee replacement. If we jump into the inflammation, the swelling portion, this is where we're looking at limb circumference, and this is the different parts of the leg that I looked at. What we see is within the knee, and again, we have to understand this is from pre-surgery. They had the surgery, and then 4 days later, the limb circumference around the knee went up 35% with the tape, and it went up greater if you just had exercise. So without tape, it got bigger and puffier. And as we move away from the surgery site into the thigh, for instance, we see that in 4 days, the limb circumference got back to its original pre-surgery state, where without the tape, now we're seeing it's swelling up to 10% increase. And then actually, as we get into the calf, having the tape on for 4 days actually made the calf smaller than it did even pre-surgery. And then the same idea where we have with the ankle. So the further you get away from the site of the surgery, we see the impressive improvements. But essentially, what it's showing us that it gets you back to better than pre-surgery levels. The next objective measure we're going to look at here is range of motion. We're going to touch on this again with our last study, and the reason being is that I believe this range of motion increase is based on just getting rid of the inflammation. As you get rid of the swelling through the joint, then obviously the joint can be free to move and express its normal range of motion. And this is with a knee that now is replaced. So I think by proving that we got rid of swelling, that proves, and you would expect the range of motion to increase. We're going to dive back into the more the neurological piece at the very end here, and how we can get the range of motion to increase by affecting the nervous system. So from a fluid transfer, from a swelling inflammation standpoint, and from a pain standpoint, the way that we know that we're going to get these benefits is that the Spidertech tape, which is a cotton fabric with elastic property to it, is going to go on the skin, in this case the knee. It's going to retract back on itself and it's going to lift the skin. And so by doing that, we elevate and we open up those lymphatic vessels like we see on the screen here, that would normally be squished by swelling coming from below, where in this case the tape lifts it up and we're able to pry those vessels open, and then the fluid can move out of the area and kind of act as it would without the swelling. And the beauty is that we're not just hoping that this works by lifting the skin up. We know that there is physical connection between the skin and these lymphatic vessels right underneath it, and it's through these anchoring filaments that connect above and below that we know that those vessels are going to be pried open within the interstitial space, which is going to be sitting right between the skin and the two layers, superficial and deep layers of fascia. And for another visual here, we can see that the tape, the elasticity in it, is going to lift it up. By lifting it up, we get those vessels to open up, and we go from a squashed lymphatic vessel to a round open vessel to allow the fluid to move out. And then the fluid moving out has huge benefits in terms of pain as well. Desensitizing the nervous system, not being swollen, all ways that pain is going to go down. All right, so I think that checks our first box of how can tape improve pain and fluid transfer, swelling and inflammation. If we dive into our second request, which was our functional ability, we'll look at a paper here. This paper quite interesting, where we're looking at the ability to recover after being fatigued. We're looking at the ability to improve balance, improve proprioception, improve our patterning after we have a fatigue, and this same idea will hold true with an injury as well. So anyone who's tired, anyone who has arthritis, anyone who's dealing with an injury, surgery in the past, or some kind of acute injury, all would kind of fit in this category, and we'll kind of explain why through this paper. All right, so I think important initially to take a peek at how this study was done. And we'll look at that from a couple different angles, but essentially what we did was, or what they did was, they took half the people, they put tape on them, the other half didn't have tape. They did the objective measures, which was dynamic balance, postural stability, and looking at knee proprioception. They fatigued the people in the study, and so here we used 30 minutes of downhill walking. There in this study was older men, so that in theory was enough to make them tired. Other studies look at different categories and they use different fatigue protocols. And then they tested the same things, the dynamic balance, the postural stability, and the knee proprioception right afterwards. So we get a sense of can we maintain our levels before and after. Now, the last thing I'll say here, what we don't have is we don't have a comparison between not having tape, getting tired, and then putting tape on. But I think we can kind of bridge that gap here at the very end, which we'll do. So if we look at the dynamic balance, this was, the test they used for this was a walking step over test. So they had a dowel at knee height. They had the people in the study walk towards it, step over the dowel, and they measured how much they swayed from side to side, how much they were able to keep their balance and stay in line. And so what we see is with no tape, that there's a 10% increase in essentially the losing your balance, the swaying from side to side, an inability to kind of maintain your positioning. And again, this is not tired to being tired. So from before and after the fatigue protocol. And then we see with tape that essentially we get the same value. So even though we had the fatigue protocol with worked in here, that by having tape on your knee, now all of a sudden you maintain your normal level of balance. With our postural stability, in our next category here, this was a single leg stance. They have the people standing on pressure plates to get a sense of the center of gravity movement from side to side. We look at what happens if you don't have tape on your knee. And it turns out that you lose about 20% of your postural stability if compared to where you'd be if you weren't tired. And again, with tape, you're only at about 3.5% rise or detriment in your numbers. So pretty close to being exactly as you would at your best. And then last but not least, we see the proprioceptive ability, and this was a knee reposition test. So how can you kind of go back to the angle that you were asked to do? They had the people sitting on a chair, and then they would extend their knee and kind of go back to a certain angle that they were asked to do. And we see a huge increase here from not having tape to having tape. So all tests that look at our ability to hold our balance, hold our proprioception, and hold our ability to kind of keep ourselves in an ideal state, which is going to be the theme here. And this holds true from any joint, any area of the body that we're looking at. If you fatigue the area, if you apply tape to that area, you're able to maintain almost an optimal state by having tape on there. So the other piece we're going to look at here with this graph is we have our two categories, and the important thing to see here is if we look at our starting points, this is going to be a consistent pattern again where the tape makes you just a little bit better when you're at your best. So the starting point, there's no fatigue protocol, but the tape makes you a little bit better at, for this one, this was the proprioceptive test. This was knee repositioning. But as soon as you get tired, now we see the tape hold baseline and the non-tape side spikes like crazy. So we see these big increases in the ability to hold your balance. And then as they conclude, and which was very interesting as well, is that, I mean, it's quite obvious here that we're able to counteract our dynamic balance, our postural stability, our knee proprioceptive things that were tested. And as a result, the tape was able to attenuate these issues and kind of get you back to your normal state. And as they tested older men in this study, they concluded that this could be very impactful in preventing exercise-related impairments and balances, and then have significant impact on fall prevention. So I think we can anticipate that when you're tired and you have a tendency for balance issues, that's where falls are going to come in. So in older adults, you can get ahead of the issue. You can prevent falls from happening if you know that your clients are going to be active, if they're competing in sports, by proactively putting tape on the area of their body that you think they're going to be tired. All right, and then our third and final study. This looks at using kinesiology tape for patella tendonitis. And again, as you would expect, tape is not going to be the only thing that you do. Tape is going to be the add-on, but it is a very significant add-on. In this study, they looked at using kinesiology tape on the knee compared to ischemic compression using manual pressure on muscles in addition to exercise. So here's our exercise program. This is pretty standard, encompassing. I'll note here that for the strengthening exercises of the knee flexors and extensors, they did use isometric holds. So I think that would be the only piece that you would look and say that they're missing from what's in front of you, but they did actually use the isometric holds for 3 sets of 10 repetitions, which may not be the repetitions that you would use, but it's pretty close to being optimal. And then also, as we see, they did some stretching, they did some hip strengthening, and they also did some eccentrics on a single leg incline board, which would be great for building the strength through the tendon. But again, those isometrics is probably where you would go to decrease the pain, which is going to be one of the objective measures that they tackle in this study. All right, so diving in, again, we're going to look at pain levels. We have again, sorry, this is a four-week study, so to the baseline to now, we see that with the kinesiology tape, we are seeing massive improvements in pain, 83%, which is pretty darn improvement, or pretty impressive. We see the improvement with ischemic compression also very good. I mean, the interesting thing here is that in real life, you're going to do both, right? You're going to do the exercise program, you're going to do the soft tissue, and you're going to do the taping. So we can expect even greater results than the impressive things we see here. And again, they use the visual analog scale, so we're looking at like an 8-point improvement here in pain. And then disability, we see similar big improvements with tape and exercise compared to soft tissue work with exercise. We see we're almost kind of cutting the disability in half, and for this one they use the WOMAC disability study or disability questionnaire. And then last but not least, we are resting muscle tension, which was again one of our wishes. It was one of the things we wanted to do, which was not only decrease the pain, increase the function, but we wanted to actually have an impact on the muscle itself that surrounds the joint. And so with this, we see that being the case, that we get almost back to our normal resting muscle tension by using tape, in comparison to our ischemic compression, which didn't have that ability. It didn't prove to do that. So I think that's the last piece to our puzzle where we can not only get to the pain, the disability, but we're able to have an impact on the tissues around it. To allow the joint to kind of express itself as it should and be as optimal as possible. And then here's a conclusion of our study, and you can see here that they commented that the tape was more effective with exercise than ischemic compression. I will also say that the ischemic compression had good results. I'll say that in practice, we're going to do all three of these things. This is all within our toolbox. We're going to be able to cover all three, if not more, different interventions for everyone with patellar tendonitis. And I will say that from personal experience as well, that this is exactly the benefits that we see. Most of the competitive patellar tendonitis that I've worked with personally is within tennis players. And the exercise portion is very important. We can use the isometrics to decrease the pain, but adding the tape in makes a significant improvement every time, and it's really a no-brainer to add that in my opinion. And I wanted to take a look at quickly how we get that nervous system impact that we do, how we're able to have an effect on the pain, but also the muscle tension. So I mentioned that I mentioned that before, that we saw the range of motion increases. The range of motion increases with getting rid of swelling. I think this is how we see the range of motion increases by decreasing muscle tension. And so, for instance, if we were looking to increase the knee flexion with the patellar tendonitis, I would expect that because we're able to normalize the tissue tension in through the quad, that normalizing tissue tension would allow us to express more knee flexion. So I think that's the nervous system version of the increased range of motion that we can expect. And the place that it all happens is right at in the dorsal horn of the spinal cord itself. And so we have our C fibers, which is going to carry for the most part, our painful stimulus. It also carries our temperature for hot sensation. So you can kind of picture that when you go and touch a hot stove, it really takes a moment for you to be able to, yeah, that is hot, you're right. Like, it takes a moment for the message to be sent to your brain that the stove is hot. And it's the same level of speed that we see with the painful sensation going to the spinal cord. So the way we're able to counteract that, and the way we're able to have an impact on that, is that Fortunately, the sensor is within our skin that the tape is applied to. It travels in a much faster, bigger myelinated nerve. So our A beta fibers are the ones that take the information from our skin, primarily through our Merkel cells, transfer it to the dorsal horn at the same time that the pain is getting there. And then in primarily lamina 4, but throughout a couple of different lamina in that dorsal horn, the A beta, the fibers that are carrying the information from our skin, it really outcompetes the C fibers. It outcompetes the pain sensation. And so it is called sensor gating because the idea is that the pain sensation gets shut down, gets pushed aside. It doesn't get transferred across the spinal cord, which would then normally ascend upwards. So we're able to, in this case, have the information blocked before the information even gets to the brain, and then for the brain even to decide what to do with it. So this is kind of the origin for how we take care of the pain from the nervous system standpoint, but also as a result have an impact on that resting muscle tension, because now all of a sudden the brain doesn't have to decide what do I do about this pain sensation, which predictably would be to increase the tone but decrease the ability to have a big contraction. All right. So that kind of covers our three bases there. I do want to cover next how we apply the knee ProCut, and then we can also see how it can have all these benefits within the application process. So I'll follow along with our YouTube video, and this video is on our website for everyone to see at all times. So here's our knee ProCut. The first thing that we're going to do with all of our ProCuts is that we make it very simple for you to apply. So we're going to bend and break all the perforations that are pre-put into the backing paper. Anyone who's familiar with using our tape knows that this is a extremely easy process. We're going to apply the first piece just below the kneecap, right over top of that joint line. And so that's where a lot of the benefit for arthritis or any kind of joint line issues that we have, meniscal irritation, any kind of joint sprain, that first piece goes right over top of the joint line, which helps us kind of achieve those benefits. The next pieces, we're going to go up around the patella, and the tape is angled in a way that it naturally goes to the opposite side of the thigh. So you don't have to pull it yourself, you don't have to guide it, the angle automatically glides over. And then we're going to, on the other side, do the exact same thing so we get an X cross over top of the quad muscle. So we cover the entire quad muscle. And as you can see here, we're doing it with the knee bent to 90 degrees, and that's to make sure that we'd never run out of range of motion. If we were to do this in a straight knee, if you were to bend your knee, all of a sudden we're going to run out of stretch in the tape. For the last two strips, we're going to straighten the knee, and we can do this because these two strips don't cross the joint line, but they do cover over top of the lateral part of the quad. It does cover over top of that IT band, and then on the medial side, we're going to cover over top of the medial quad and any of the adductor that we can kind of catch the corner of there. So in this case, we got the joint line for any kind of joint issues. We go up and around the kneecap for the proprioceptive improvements, so our brain knows where we are at all times. We get it around both sides of the kneecap, so we have tons of information going back to our brain for the balance, the proprioception. And then the last piece, it gets up and covers that quad to have an impact on any of the resting or any of the muscle tension that would be there. Any tension that we generally see with a knee injury through the quad, we get that constant feedback from the tape, and we can have a normalizing effect that we saw in the last study based on having the tape there all day, every day for the duration that it's on. And for that, we're thinking anywhere between 4 to 7 days, depending on the skin, the amount of hair, and so on. And I mentioned before that that video is it's on our website. There's a QR code within all the packaging, so it's at your fingertips anytime that you have a knee ProCut in your hand, and it's as simple as just clicking on it, and you can see the video from start to finish. All right. So as we wrap up here, we're going to revisit our criteria that we wanted to achieve, and I will mention again that that this is all being achieved between our treatments. And so you're doing your normal treatment, then the tape goes on, and then your client would come back to you in a better state. And so we saw that the pain, inflammation, and swelling was able to decrease, both pain-wise from a decrease of fluid in the area and a decrease of sensitization as a result of the fluid being there. We also saw that the pain went down because of the neurological impact that the tape has on the sensors of the skin, and how that can block the pain sensation at the spinal cord level. So two mechanisms of getting at the pain. We get the pain, the swelling, and then as we get into our functional categories with the range of motion, the balance, the proprioception, we saw that when you are at your best or your normal state, the tape can expect to have a minimal impact, usually a positive one, but comparatively minimal in comparison to when you are not at your best. So when you're fatigued, when you're injured, when you're dealing with an area of the body that has been put on a post-surgery, or if there's a reason why your joint isn't at its best, that we can see these big changes in the balance and proprioception that the tape is going to provide to your brain. So you're just feeding your brain more information about the area that we're trying to protect, essentially. And as a result of that, the movement patterns get smooth, the movement patterns get back to your optimal and normal patterns. And then the range of motion, again, we saw that both from a swelling standpoint, both from a neurological standpoint, we can expect an improvement in that ranges. And then lastly, we see that the tape being on the skin, providing feedback over top of the muscle that would be tight, for instance, that can have a normalizing effect on the tissues that it lies over top of. So having for this example, we use the knee. The quad would be a very common thing to be tight, but if we can extrapolate that to all the different joints and all the different joints of the body. One common area that I will do, if anyone here has been to one of our in-person classes, we always do testing in dorsiflexion. So what we'll do is we'll test everyone in the room's dorsiflexion. We'll put the ankle ProCut on, then we'll retest. And in our experience, about 80–85% of people in the room will see at least a 2 centimeter increase in your dorsiflexion. And then we've even done in the past where we retest afterwards. So we go dorsiflexion without tape, with tape, and then without tape again. And what the pattern we see is that when you take the tape off, we see a kind of splits the difference. So if we saw a 2 centimeter difference, a 2 centimeter increase in dorsiflexion with the tape, once we take the tape off, we'll then see a 1 centimeter increase in dorsiflexion. And if it was 10 centimeter increase, we would see a 5 centimeter decrease once we take the tape off. So kind of showing that lasting effect, at least for the duration that we're retesting again. And there's the reason why we had the confidence to include this in our in-person courses is because there is research to back it up. There's research that kind of that shows us that this is the case and what we can expect. And again, like proving our point where we're able to have an impact on that muscle tension and allow us to express our normal joint function if tension is part of the reason why it's being restricted. And lastly, we were looking at how we can use Spidertech to affect our painful joints, and I think we can check that box for sure. I think that can have a tremendous impact on our joints. I think it's something that you can put on your clients, and their experience with your treatment goes up significantly, even when they aren't in your treatment room, which is sometimes hard for us therapists to understand because they aren't in front of us. But I do think you'll find that they'll come back into you into their next session, and the tension is decreased. You'll see these improvements happening faster, and they'll express a better experience. And then also, we see how we would use the knee pro-cut in this example through that YouTube video, which you have access to anytime and any place through your phone or computer. And then we will finish with what we aim to do here at Spidertech, which is leave a lasting impression for your clients. And we're able to do this because we have a pro-cut for every part of the body. We're able to do this because our pro-cuts are able to improve our posture, our muscle tension, our swelling, bruising, proprioception, help the injury rehab process, and also help to decrease pain from multiple different ways, whether it's from fluid or a neurological basis. We mentioned it's a treatment between treatments. I think that is a really important thing to keep in mind. This doesn't compete with anything you're currently doing in your treatment process. And then as well, as a result of using a high quality product like ours, one that looks really good, one that it's all machine cut and looks like a high-end product, that translates to your clients thinking that your treatment is high-end, and it also translates into everyone that sees your client with the tape on thinking that they're getting high-end attention and therapy. And it's so often that I'll have clients coming in to see me, and it was a conversation starter with people they saw on the street, or people that their friends that they had. They see the tape on, and it leads them to just telling the story about what they're currently working on rehab-wise, and why they're using tape, and who they're currently seeing that puts on the tape. So almost like a high-end business card for your walking around client to tell the world about your treatment. We will conclude our webinar number 5 there. We're going to jump into our Q&A session. I'll say before we do that, though, is again, thank you for joining us. We're going to be here again next month. We're seeing better numbers or bigger numbers every single month. We're really excited about it, and please fire your questions in here, because it helps not only you learn, but it helps everyone over the triple-digit number of people that are here today. It helps them learn as well, and it gives us ideas for ways to expand and ways to give you the answers that you're looking for in other platforms as well.
So Nick, I just have you muted, so don't worry, I can't hear you right now.
Yep.
Robin, in the chat, you should have just received a message that has all the questions that Larry compiled. Robin just sent to you. Do you see that on your Zoom?
Give me 1 second, everybody.
We're coming at 1:37.
Okay. Yeah. Yeah. I got them.
Okay. Hold up.
I'm gonna send you one more. They just came in.
So did you? Oh, so you. Good morning. Ah.
So the person that asked it, their name is at the end. The sequence of the questions is there, and the question itself.
And then the first question, yeah, number 1, the good morning one. Mm-hmm. Okay. Can people hear me now?
Yep.
Okay. Thanks, everyone. For our first question coming in from Karen is good morning. Question: percentage pull on the tape versus stretching joint. Please clarify best options. So I think we're speaking of pull or stretch on the tape. I think that's what the question is referring to. And we do have postural. We do have kind of postural pro-cuts that do add tension to areas of the body. In general, though, for the knee, for instance, I'm not going to use any tension on the tape. We're taking advantage of the rubbing on the skin. We're taking advantage of the proprioceptive feedback we're getting. The reason I'm not using tension in general is we have something like the knee or the shoulder, which has a huge amount of range of motion. The tape itself it stretches 40% more than its initial position, so it stretches to about 140%. If the range of the joint exceeds that 40% increase, then all of a sudden we're going to have a problem. And that's generally where we see the issues being with the tape irritating the skin, is they are stretch issues. The issue is the joint went further than the tape was able to, and then that ends up pulling on the skin. And the reality is that the research shows that it doesn't really matter. That the stretch on the tape doesn't have an impact. The stretch on the tape doesn't have an impact, but it does have an impact on the injuries that would come as a result of the tape, even if they are minimal themselves. As well as, I mean, if you want stability, if you want actual stability, like the tape is designed to allow your body to control yourself better. It's not designed to lock it down like a white medical tape is designed to like lock something in place. Our kinesiology tape is designed to allow you to express your range of motion with more control. But I will say that you're the therapist. You use your.
Just to be clear, the tension of the tape with the joint in the stretch position. Is that what you're saying? I just wanted clarity on that.
Say that one more time, Karen.
So you're just doing tension that comes off the tape as you peel it off with the joint under stretch.
Yep. So I'm gonna. Yep. So, thank you for clarifying that. That's fantastic. So what I'll do is I'll put the area that we're applying the tape to. For instance, if we're going up around the quad, I'm going to bend the knee to 90 degrees so that the joint is stretched. If we were putting it on the low back, we would have them flex forward as far as they can, so we get to kind of full range of motion. That would be consistent with all the applications. And then we're going to put the tape on with no stretch. So like the tape is on the backing paper with about 10% stretch, but I'll even try to go with no stretch, so we can express full range of motion, and we're not going to have any issues with skin burn. All right, great first question. So question number 2 is, I realize that this is for joints. Is there advanced taping for medial meniscus tear, or perhaps is there a video? Again, for like a medial meniscus tear, if you're in a position where you have a joint that's really not stable, that's where I might go even kind of like tape with a brace itself if you're concerned about stability of the joint. Usually with a meniscus tear, like it'll just hurt a bunch. We're not really concerned about the stability, but so that the tape gets on there and essentially kills the sensation of, or decreases the sensation of pain, and allows your brain to be more specific in how you use the joint. It allows you to kind of get back to where you would be without the injury, and that's the way you kind of proactively prevent the injury from happening. So like what I'll generally recommend is, if you are doing something that you fear that you're going to re-injure your knee, I'll put tape on with a brace. If you're in your walking around state, if you don't think you're doing something that you're going to re-injure an unstable joint, then that's where I'll just use the tape like kind of all day, every day through there. But again, you being the therapist, you can use your judgment to based on the client and patient in front of you, but that would kind of be how I would generally attack it. All right, so number 3 here, ACL tear protocol, pre-surgery and post-surgery, please. Again, from Karen, yeah. So from a pre-surgery standpoint, again, we're getting the tape on there to help with the decrease any swelling. There's obviously a reason why that you're going in for surgery. So cleans up the swelling, increase the proprioception, decreases muscle tension, and then post, again, we're using it so we have more control of our knees. Like there's a number of research studies that will show that the same way we saw with being fatigued, post-surgery you'll see the same results, where you just lose that balance, you lose that control, you lose that proprioception, and the tape gets you back to more of like a pre-injury state. So the tape, again, was not going to be the only treatment you're using. You're going to use all the things that you normally would do. I would just increase the awareness of the joint, which will in turn will decrease the incidence of re-injury, because you're able to be smarter about what you do with your knee by adding the tape in all day, every day. All right, so do we get the same results in other joints in the body? Yep, thanks, Holly. And yeah, the answer is absolutely. We see, in terms of they'll commonly kind of look at repositioning of the shoulder, for instance, with different angles and ranges of motion, and the tape will improve that. Well, I mentioned that the ankle, we're able to increase the range of motion in dorsiflexion by adding tape in there. These are all principles that really span throughout the entire body. From an ability to kind of have an effect on the nervous system, you'll see with chronic low back pain patients that one of the hallmark signs is the erectors won't, and the erectors in their low back muscles won't relax when they flex forward. There's research that will show that if you put tape on, instantly those erectors will relax. I think it's about 43% of people that have that issue. So these are all principles that span all the joints of the body, which is pretty exciting, and it's something that Spidertech having the ProCuts that address each one of the joints in a very educated and thought out way, that you can get great results by learning how to use the ProCuts, and it's kind of as simple as that. You don't have to learn about the different patterns, the tensions, the so on that you have to do using a roll. You're able to just get the higher end product by using the ProCut, yeah, in my opinion. All right, so Kim asks, how long does the tape last on the knee? And this is going to be, I touched on this briefly, but it's going to be dependent on a couple things. First of all, there can't be any creams or lotions on the skin. That's a very important piece. So sunscreen's a no-go. Anything that's oil-based. In the clinic, if I'm using a cream or a lotion, and I know I'm going to be putting tape on there afterwards, I'm always going to use a gel lotion or cream that isn't oil-based, and then there's no issue whatsoever. But as long as there's no oil-based cream on there, as long as the tape is able to adhere to the skin, it doesn't get caught up in the hair. Some hair is important because pulling on the hair does increase the amount of sensation that the skin is able to send to the brain. So the hair actually is an important piece of increasing and maximizing the amount of messaging to the spinal cord and to the brain. But the tape can't sit on the hair. The tape has to be able to have flush skin contact. And then as well as depending how oily your skin is. But if we cover all those bases, we're looking at 5 to 7 days expectation of how long the tape should last on the knee. And then obviously the amount of range of motion in the area of the body. So for instance, putting it on the wrist will have, because we're bending it more throughout the day, that has a more wear and tear than, for instance, the low back would, for instance. So that does matter. But yeah, like you're expecting almost 5 days to a week out of a properly applied knee ProCut every single time. And then it is water resistant. You can wear it in the shower. You can wear it while you're bathing, you're swimming. So there really is no reason to kind of take it off, or there shouldn't be an expectation that it will fall off. Yeah, good question about the patellofemoral syndrome. And so, I mean, I guess classically the patellofemoral syndrome kind of came out of the idea that the VMO was tight, and it was kind of causing the patella to shift off kilter. I mean, that hasn't proved to be reproducible, but it does bring up the point that the tension through the quad, the tension through the muscle, that has an effect on the patella itself. and that we showed that we can normalize the tension in through the muscle by applying tape to it. So we should, with someone who has patellofemoral, whether it's due to it's causing pain from irritation underneath the kneecap and itself, or from other reasons, we should be able to have a significant impact on it with using kinesiology tape, being that we're able to have an impact on the proprioception around the knee, so we have less motion, internal and external, but also kind of medial laterally as well as the ability to normalize that skin tone. Yeah, good question, Karen. Appreciate that. With IT band syndrome, are we expecting, or should we be using the hip application and the knee, or just the hip? I would say it depends on the patient in front of you. If the irritation is down at over top of the femoral condyle, if we actually are getting rubbing over top of that IT band, down by the knee, then that's where I would go with both. That's where I would go with the knee ProCut in addition to the hip ProCut. I think just on a kind of addressing the person that you have in front of you, if you think it is a hip issue, which I mean, I haven't seen it not be partly a hip issue. That's where we see the great results with the hip ProCut in terms of getting kind of normalizing that glute medius. Really all three of the glute muscles with muscle tension wise, and then being able to exercise, increasing the strength in through there more effectively. And then also if we're looking at just the decrease in the pain sensation down at the kneecap itself, or sorry, at the knee joint itself, that's where the knee ProCut comes into play. So what would I normally do? I would normally do both, but you get to get to choose your own adventure with that one based on the person in front of you. Fan pattern applications. Excellent question. That the fan is it's the only ProCut that we have that is designed to be used all over the body. So with our fan, we can use it anywhere that we're trying to decrease swelling, inflammation. We're trying to improve fluid transfer out of an area. So whether we have a bruise, whether we have some congestion, whether we have swelling, whatever the situation causing the puffiness, the swelling, the inflammation, that's where the fan comes in. In general, I'm going to put the fan on and try to promote the fluid to move up towards lymph nodes. So you're gonna kind of understand the lymphatic system and kind of bring the swelling up back towards our lymph nodes to kind of clear it out as fast as possible. So for here, we have our fan video and we're using this on the knee. So I'm going to kind of bias the medial knee here to take advantage of the lymphatic system there. I'm going to apply the base at the proximal end. Usually that's just because that's where the clothing is, and so that's more of the secure area. And then I'm going to take the middle strips. This is just for the aim. We're going to apply the middle strips over top of the middle of the kind of the puffiness, the swelling, the inflammation, and then we'll put the two middle strips and then we'll move out towards the outer strips, enabling us to cover the whole area that is swollen and puffy. So, I mean, this one can be used all throughout the body. We do recommend that we mentioned the knee, we use no tension. With the fan, we're going to use the paper off tension, and we use the paper off tension, which is about 10% stretch, because we want to maximize the lift, and with the swelling, with the injury that's there, usually the range of motion isn't going to be full, and so we don't have to worry about getting to the end of kind of skin tension. We can add that little bit of extra stretch, and so we get as much of a lift as possible to pry open those lymphatic vessels and get the fluid to move out as fast as possible. We also do put the fan in a pattern where we have the width of the tape strips open. So we go fan 1 centimeter, no tape 1 centimeter, fan 1 centimeter, and then that pattern. And the idea being there is we can improve, or we can increase the fluid moving towards the tape. We can based on the osmolarity gradient of the pressures of the tape lifting the skin, decreasing the pressure of underneath it and through the tissue, we can promote the fluid to move towards the strip there, and that's the way that the fan differentiates itself from just a strip of tape. Where the strip of tape, it lifts the skin up, which is very impactful, but it doesn't take advantage of that osmolarity gradient quite as effectively.
Sorry, I'm just going to unmute so I can ask you more questions
Yep.
about the fan. I commonly use 2 fans and a crisscross or do an octopus.
Yes.
Is there an optimal way? It works really well for bringing down edema. It also seems to be pretty great on muscle tears. Absolutely love your products. Pretty much everything else on the market, with all due respect, is crap. Can you just go over when to use a large fan, a small fan, when to do octopuses, when to do crisscrossing? Sorry, I'm just, my mother described me as a curious child, and here I am, a curious adult. Sorry about that.
Karen, I love it, and if you would go back to the part where everything else is crap, we would love that as well. But yeah, so the crisscross is a common way that we recommend. We teach it in our courses as well. The way I think about it is the crisscross does cover more area because we get the fans over top of one another. So we get more skin coverage. So if the area of swelling inflammation is greater, then that's a really nice way of kind of increasing the surface area of the tape and opening up those lymphatic vessels. The upside is the tape over top of the tape. So you can envision that we have a crisscross where the tape is going over top of the tape that's already on the skin. We get a greater lift because the tape is lifting up even more than it was. So if you were looking for maximal improvement in the shortest period of time, I would use the crisscross, the basket weave. That's what I would use. The only downside is that the tape adheres more effectively to the skin than it does to the other tape. It still does adhere, but it just isn't as effective. So in theory, you may not get as long out of the application. You might get 3 days, 4 days instead of 5 days, but your results, I think, are going to be better. So you have that choice to make with your client. All right, guys, we are approaching that hour. And if there's no more questions, oh, we do one more. Julia. CMC support. So the next question is, we're looking at, does different body sizes affect the pro cuts? And I mean, yeah, the answer is yes. The pro cuts are designed for 80% of the population. the 10%, like the very small, the children on the low end, and then also the 10% on the bigger end. They may choose to use a different way of taping it, but that middle 80% is where we can have our maximal benefit. I will say on the high end, we just finished doing in-person seminars with all the Blue Jays training staff. The Blue Jays are the baseball team here in Toronto, and they were quite comfortable with the size of their athletes being very, very strong, with the ProCut tape being able to cover everything that they wanted to. So on the big end, I think we're looking at the really big end that it doesn't apply. But for anyone who's kind of fits in that middle range, they're fantastic for. Right. And what? Sorry. Can the person who asked about CMC support, or can you just kind of clarify what we're talking there? Are we talking carpal metacarpal support, or what are we talking about here? Yes. Okay. So the answer is kind of it depends depends what you're trying to achieve. I think if you take the principles that we've talked about today, then you're able to attack it. If we look at like what ProCuts people will use for the hand, a lot of gamers that we've worked with will use the small fan. They'll put it over top of their four fingers, and again, they just feel like they get more awareness in their hands. They're able to control their movements. They're able to to get rid of any puffiness, swelling, soreness on their hands. And so if that is what you're trying to achieve, then the small fan works really well on the hand. You just kind of put it on there and just go up the fingers. If we're talking about an instability, again, like you can cover the area, you can give your brain more information, but you're still going to be able to, which I guess is really all you generally would want to do with the hand, the hand itself. If we get into the wrist and we're getting some joint irritation through the wrist, a lot of times we'll get putting the eye strips surrounding the ulna and the radius at that side of things to provide some stability through the wrist, and then we'll find that a lot of primarily we'll use that with golf and tennis and other sports where the wrist needs to be functioning at full capacity, but we were trying to kind of provide a little bit of stability. The benefit of doing that, just wrapping eye strips around here versus using like a white medical tape, is we still do end up with kind of full range of motion of the wrist. We just kind of know more about it, and we get a little bit of extra support. And then again, if we're talking osteoarthritis, again, we're just like the benefits is going to be we're lifting up the skin, we're getting the fluid to move out of there, we're getting constant rubbing on the over top of that arthritic joint for kind of finer movements with the proprioception and dealing with pain. So I think that the principles we spoke of before with the knee would fit perfectly with the hand. And there is a number of papers that look at improving wrist and hand arthritis with applying kinesiology tape to it. So it is something you reproducibly would expect benefits from. All right, so we addressed the lymph system. I agree, so important. Any full body lymph protocols. We did I believe it was webinar number 3. We looked at using kinesiology tape for our lymphatic drainage. So we have a full webinar which is on our website, which you can look at, and we kind of cover the lymphatic system and how we can cover different areas of the body, which would answer this question a little more thoroughly. But Yeah, I think it's anywhere that we're going to apply the fan, anywhere that we think we're getting some congestion, some lymphatic issues, we're going to bias towards the lymphatic vessels to try to return the fluid to the areas there. It is a little bit different than if we're talking about lymphatic or lymph node removal, whether it's kind of for a cancer or kind of an issue where like the lymph nodes have been removed, but from just trying to optimize the lymphatic circulation from the body, get the tape on, get the fan on the area, go with a 10% stretch or a paper off stretch, bring the base of the fan back towards wherever the lymph nodes are throughout the body, and you're going to get great results. I think that's the kind of the principle there. All right, guys, that's another fantastic webinar. Thank you so much for everyone for the questions, especially Karen. That was great. And we'll see you next month. We'll tackle more topics that are requested, and we think that they can help everyone in their practice. And thanks everyone for tuning in. And we'll see you in a month.